So we're going to take a few minutes because we get people asking us questions about Envita, and being the fact that you've been in Envita now, we're in our 22nd year, and you were one of our first cancer patients that has the amazing story everybody always hears, and they also get to call you and talk to you and Mark. So tell us a little bit, a summary of what happened. I know it was years ago, but more importantly, what were the obstacles and the things that you overcame that got you to late stage 4 cancer, right? To where today, not only do you not have cancer, but you are healthy. It's not just cancer-free. She's young, healthy, energetic. Mark, too, your lifestyle has changed over the last 20 years. So this kind of stuff, because I think people want to know, how, not only did Envita help you, but also, how did that change your life? So give like a little bit of a background for.
Well, 20 years ago, integrative medicine was not even really a word that anyone knew or understood, not even natural medicine. And so, of course, when I first got diagnosed, I had emergency surgery to remove a blockage. But what happened by the time we went in at one of the cancer centers, by the time I went in, it was already had spread everywhere.
So people will know this, to give a heads up here. This was a very fast-growing colon cancer.
Aggressive.
You went to 2 of the top cancer institutes in the country. We won't name their names, but one of them's here in Arizona, the other one's in New York, and they are the best of the best, supposedly. And they told you, listen, if we take this out or do whatever here, you're going to have a 20% chance of return, but that's in the first year, and even a higher rate in the second year. So
20% chance to live.
To live.
And
okay.
99%.
One gave us 30, one gave us 20.
To live. Beyond a year.
Yeah. And if they got it all, then it would have a 90% chance of coming back.
99% chance, because it was so
even
aggressive.
if the tumor was fully removed, they said it's going to come back. 99. What do you?
Well, because
that's why we got the 20 or 30% chance to live, because it was so aggressive.
So all that's going on, and I know you have the story of your procedure. Because back then Envita was a very small little facility, not today where we have campuses and researching people. We have pharmacists, doctors, nurses. I mean, we have a big team. We have 170 people. When we started, it was me, you, a handful of people. But I want you to share what at that time got you to think differently. You knew you needed to do something different, because it's no different today.
And I had the signs of the cancer in May of that year, in 2001. And I was very physically fit, and taekwondo, bodybuilding, runner, I did everything. And when I went in May to my regular doctor, she just said, you should be fine. Well, come September, it was already stage 4. I should have seen the signs. Nobody thought to screen me because of my age.
Your age, you were young.
So
and you were how old at this? Was 39. So when people are telling you that you should get your first screening in your 40s, really, people with even have any kind of family should be in the 20s, and you're starting to, now they have other. It's just important for people to understand that.
Out of all the specialists that we had talked to, you were the only doctor that just made sense. It was common sense to build the immune system. If it's going to be torn down with chemo and radiation, I saw what it did to my own aunt and my own grandmother. They both had stage 4 colon cancer, and they didn't make it. I felt that even just by going with you to get treatments that were going to help build up my immune system, that even if I may not make it, I was still going to be in good hands. I was good either way.
You had explained to us what you were going to do, and if we were going to go with you, and how you would rebuild the immune system, and how cancer can't survive in an oxygen environment, and cancer can't live in an alkaline environment. And all this stuff was new to us, but made so much sense. We got a whole education on why cancer forms in the body and how you can eradicate it out, but you have to rebuild the immune system. And we never heard any of this before from the other hospital. We felt like they were just guessing over there, and that they didn't really have a scientific approach to it. It's just like, you got cancer, you take this off the shelf, give you chemo and radiation, and pray for the best.
It's still the same. It's NCCN guidelines with minor modifications. Everybody gets the same program. The problem is everybody's cancer is different, their targets are different, and it takes a lot of work
So
to try to
I
find
want to
that.
say one more thing on this point. 20 years ago, compared to what patients have today, this is like the Jetsons versus the Flintstones, right? I mean, it's like,
advanced.
oh, man.
And so the reason she responded so well, I want to say this from the medical side, both the drug targets that she was using, I know these are fancy things, her high dose vitamin C in her case, not everybody, so all this is genetic targeting. In her case, the high dose vitamin C, praise God, because back then the technology we have now and then was very different. It actually allowed her medication to work better because it was basically, she had a Kraft-Braff mutations, which are these particular types of colon cancer mutations, and it hit her target. And when it did, it let her medication work. She responded so well, it was the right targeting. So the precision is everything. Now, today we have chemotherapy low dose, we do immunotherapy low dose, we still have ascorbic acid and all those other oxygenation therapies, but everything's targeted. We have 400% better outcomes in conventional oncology. We have 250% better outcomes in clinical trials. That's using genetic chemotherapy, using immunotherapy, using the natural integrative care. It's not being prejudiced on which treatment, it's what the patient needs.